Today on Sage Advice, our topic is whether to use ice or heat when you're dealing with low back injuries. Hey everyone, sorry I'm going a little late today, and I'm doing this in selfie mode, so I'm short-handed today, so I'm going to make sure I get this done as quick as possible, and try to get it to be as effective as possible. I'm trying to work on our quality of our videos here, so I'm working on a lot of different things. So I know the quality on this one, I'm a little shaky because I'm using my arm. I'm not using the microphone today, but we'll get the job done for you. And really, this question I get asked all the time, and people get it backwards all the time. You know, should I use ice or should I use heat? And I understand where the confusion comes in. Most people will think that they should be using heat because you're getting a lot of muscle spasms. So when you have a back injury, a lot of times you'll get pains and muscle spasm, and you get a lot of tightness associated with that injury. So people will tend to think that they should use heat for those muscles being really tight and sore, and that's a lot of times the wrong thing to do. So I'll explain it from an injury standpoint, and it works the same for more chronic injuries, because you think, oh, well, the injury just happened yesterday, that's more acute, and so maybe I should use ice. So people get that part. But a lot of times, if the injury has been long-standing or been around for a long period of time, they'll tend to want to use heat because, you know, it's more chronic. So they're thinking, oh, well, I should use more heat now because it's a chronic injury. So I'll try to cover both of those, but I'm going to use this little chart behind me to try to explain it a bit better. So anyone that's ever played sports or twisted an ankle while you're playing, you know, the ankle swells up like a balloon. You know, you twist the joint in your ankle, swells up like a balloon. You use ice on that, right? So the same thing will happen in the spine. So if this picture right here, this is all normal alignment. This is a low back picture. It's a cartoon image of a low back. But you can see the swelling here, or at least the normal alignment. That's the disc. And here's the nerve coming through right there, that piece, free and clear, and there's no issue. So that is, you know, a normal scenario. In this scenario, that's an acute injury. So you just twisted a joint in your back. It swells up like a balloon, just like you would, you know, your ankle would if you twisted it playing basketball or something to that effect, and that will cause a lot of swelling in the area. Same thing happens in the spine. The only thing different is when the swelling happens in the spine, you're going to get a lot of irritation around a nerve. It starts to crowd the nerve. Well, the body just does not like swelling and irritation around a nerve. That nerve has to go out to parts of the bowel, the bladder, well, whatever. It's got to go out to your heart, your lungs. So all those nerves come through the spine and do that. So your body's going to do what it needs to do in order to prevent any further injury to that nerve. So it's going to cause a lot of pain, it's going to cause a lot of muscle tightness, it's going to cause a lot of spasm. It's a protective mechanism. The body needs to protect that nerve at all costs. So it's going to do whatever it needs to do in order to get that nerve to work the right way. Okay? So that's where you get a lot of spasm, a lot of pain, a lot of tightness. It's the protective mechanisms of the body to try to prevent any further injury. So you really want to ice that, and you want to ice right on the spine. You want to get about 20 minutes on, about 40 minutes off. You don't want to bring heat into that area, because what you're doing is you're actually heating the muscles, which is what's protecting the nerve to begin with. So you'll heat the muscles feel better, they'll feel more relaxed. But if your body feels like there's more pressure around the nerve, it's going to cause it to tighten, it's going to cause it to tighten even more, and you're making the problem last longer and longer and longer. So you definitely don't want to do it that way. In the chronic scenario, it's a little bit different. You're not having an acute injury, but when you have a chronic back problem, every time you move or every time you try to do your normal activities of daily living, you're going to get this loss of you have this loss of motion in this back, so it's not moving correctly. So each time you're trying to move it, you're actually creating a small injury to the area because it's not doing what it should be doing. So those little injuries each day are going to be what causes the acute inflammation. So you really still want to do ice in those scenarios. I would say of all the people that come into my office, about 2 or 3% of them I may recommend heat to. And there's very particular cases where I'll recommend heat, but 95% or better I'm going to be recommending ice. You cannot get in trouble using ice, whereas if you're doing heat, you will cause a lot of trouble. So when in doubt, go for the ice, and you want to ice on the spine, not where the pain may be. So if anyone has ever dealt with sciatica and you have pain in the low back, but you also have excruciating pain going down the leg, you don't want to ice the leg. You want to keep the ice right in the center of that low back. It'll help tremendously. So there's your tip for today. Have a great day. Thanks for joining us, and please comment and share and follow us on our socials. So appreciate your time. Have a great day.